Alrighty, so today I'm going to be covering Neisseria gonorrhoeae. This bacteria is going to cause the disease, as you probably could have assumed, gonorrhea. To begin with characteristics and morphology, gonorrhea is a gram-negative bacteria, so non-acid fast, and it's going to appear pink in a gram stain. It's going to look like a kidney bean underneath the microscope, and it's going to come in little pairs of diplococci. Now these diplococci pairs, these little bundles, are going to look like a pinkish brown color. That is not the prettiest picture, but work with me. Some interesting facts about this is that these are if I could get the paintbrush, non-motile, non-spore forming, and they are an obligate aerobe. So they like to stay in the oxyc zone of an FTM tube. Another interesting thing is that their generation time is from, once again with the paintbrush, 48 to 72 hours. Moving forward, we're going to take a look at virulence factors, starting with type 4 pili. Type 4 pili are going to adhere to the host cell, and this is seen in most gram-negative bacteria. They can also allow for a little bit of motility, microcolony formation, secretion of proteases and colonization factors, but the main point is the adhesion to the host cell. The next virulence factor we're going to take a look at is pore protein, and as it sounds, it's going to act as a pore in and out of the cell to allow for diffusion of specific substances. After that, we're going to take a look at opacity-associated protein. Now, opacity-associated protein is pretty straightforward. What it's going to do is it's basically going to allow the differentiation of host cell receptors. That's mainly its function. After that, we're going to take a look at lipo-oligosaccharide. Lipo-oligosaccharide is actually pretty interesting because it is the first of the main counters to our immune system. So lipo-oligosaccharide is a surrounding layer that's basically going to prevent the entry of specific substances, mainly antibiotics and bile salts. So it's basically countering us. They're not going to be able to get in. And talking about countering us, IgA protease, our final virulence factor, what it does is it's going to release these exoenzymes that are going to cleave our IgA in half at the hinge, at that hinge segment. And basically without both of those parts, we're not going to be able to identify and kill that gonorrhea cell. So that is all of the virulence factors. Alright, next we're going to be covering reservoir and host range, incubation period, and transmission. So our reservoir and host range is going to be people. Ooh, this one's wonky. We're going to call her Marie, let's say. Our incubation period is going to be from 1 to 10 days, and our transmission is going to be sexually transmitted without a condom. Some interesting facts about it. It is more likely to be transmitted from a man to a woman rather than from a woman to a man. And it can be passed down from mother to child, our wonky little child. So next we're going to take a look at the pathogenesis of this disease. Now, gonorrhea is going to take place in the urogenital epithelium. So that's what we're going to pretend that this is. And it is going to create little biofilms or microcolonies across the surface. And using lipo-oligosaccharides and outer membrane vesicles, it is going to trigger peptidoglycan sensing cytosolic receptors and toll-like receptors. So say that. And it's going to get into the cell. Now, when it gets into the cell, this is our little bundle, it's going to be eaten up by phagocytes, as you probably could have assumed. Now this is going to trigger our innate immune response, and it is going to release cytokines, and chemokines, which are going to bring in neutrophils. Now, neutrophils are going to be like, all right, I'm going to take it from here. And so they're going to take these gonorrhea, and they are basically going to facilitate its transmission. It's going to do this by creating a neutrophil-rich purulent exudate, which is basically an inflammatory exudate consisting of neutrophils, cytokines, and lysosomes. And it is going to exit out of the cell. There's going to be quite a few of them. And they're going to facilitate transmission. So finally, we're going to take a look at signs and symptoms, treatment, and prevention. So starting off with signs and symptoms, some common ones that you might see is fever. You will see possibly some abdominal pain, along with the constant need to urinate. You'll experience a sore throat, probably. And you may, if my mouse would work, see spots of blood on toilet paper. Some other common symptoms that you might see are painful urination, discharge from genital region, and possibly some straining during bowel movements. Treatment, there's going to be 2 drugs involved. There's going to be ceftriaxone, and what that is going to do is that is going to inhibit mucopeptide synthesis in the wall of bacteria. The next drug that we are going to see is Zithromax. Now, excuse the color because it just goes along with it. Zithromax, what that is going to do is it's going to inhibit protein synthesis in the bacteria. And so it's suggested that ceftriaxone is taken intramuscularly, and it's followed immediately with Zithromax. Moving on to prevention, some of the most common and probably obvious to some people preventions are to, well, use a condom, to limit your number of partners, and, most obviously, do not have sex with someone you know has an STD. And that's all. Thank you.